Hi folks, I'm Dr. Ed Beyer. I'm a chiropractic physician in Tinley Park, Illinois, and I'm making this video to kind of explain our model for looking at people with chronic illness. Chronic illnesses are epidemic right now because our traditional medical system is really good at treating acute illnesses like infections and broken bones and heart attacks and strokes and things like that. But our clinic specializes in looking at people with chronic illness, people with chronic fatigue, thyroid issues, problems in the brain like vertigo, balance disorders, depression, anxiety, you name it, anything that's a chronic illness. We have a very unique approach toward it, one that I think really works. And here's our model. I want to explain it to you here on this short video today. The one thing that all chronic illnesses have in common is they have underlying metabolic problems. And here's really a great definition of metabolism. What metabolic problems are, or what metabolism is converting the food that you eat into energy. The one thing, if someone tells me they're fatigued all the time, they have a chronic illness. There's something causing that. When we eat our food, it should be assimilated and be converted into energy. Now, there's a lot of steps in between here and here, such as you got to be eating the right food, and sometimes even eating the right food, some of us have food sensitivities. We react to that food, our immune system reacts to it and causes a chronic inflammatory response, which we always check for. You have to be digesting your food. In order for that to happen, you have to have proper stomach acids, the gallbladder and liver got to work right, your pancreas has got to work right, and you have proper motility in the gut. So absorbing and assimilating in the gut. Once our nutrients get into our bloodstream, they have to get put into the cells by way of certain hormones, the main one being insulin. Once they're in our cells, our nutrients got to be converted into energy in a very important part of the cell called the mitochondria, which is the powerhouse of our cells. And that organelle in our cells requires lots of B vitamins, certain enzymes, amino acids, and things like that in order to convert our nutrients into food. And then we got to be able to get rid of the things that we don't need. And for all that to work, we need proper pH. We got to make sure our body is slightly alkaline, and we have to have proper hormone functions such as thyroid and all of our sex hormones. So converting our food to energy, if you're not able to do that for whatever reason, that is a metabolic problem. Now, the thing that you need to understand is this relationship between proper metabolism and your nervous system and brain function. 30% of our energy goes to our brain and our nervous system. And our nervous system, folks, controls everything. Your neurons in your brain are like little car engines that get 2 blocks to the gallon. They are always using energy, and you cannot store energy in the brain like you can in the body. So the brain really lives check to check when it comes to energy. It needs a steady flow of glucose and fatty acids for energy. Now, what we see clinically is when you don't provide the brain enough energy, certain neurons are going to start to malfunction, and you're going to have neurological symptoms. Now, these symptoms aren't the type of, or these problems aren't the type of problems you would see on an MRI or a CT scan that a medical neurologist would look for. They are more functional type of neurological problems, which we look for clinically. There's 5 categories of symptoms that we're going to see when the brain doesn't get enough energy. Number 1, abnormal sensations. A very common one is chronic pain. This is what happens in fibromyalgia, for example. Our brain, our pain fibers in our body are constantly firing all the time. Every time our clothes touch it or we stand on our feet, our pain neurons are always firing. The brain's job is to make sure that it inhibits pain all day long. When the brain gets weak because it's not being given enough energy, those pain inhibiting neurons and neurotransmitters in our brain don't work so well, and these are people that are in chronic pain. Numbness and tingling is a common one. Cold all the time, or hot flashes, cold hands, cold feet. These would be symptoms of neurological symptoms due to malfunctioning neurons in the brain. The second category that we're going to see neurologically is abnormal movement. Now, movement can be like a tremor. It could be muscle weakness. I have a lot of patients, my extremities are weak all the time. Muscle spasms, twitching of muscles. This could be a balance disorder, or you turn your head and your ocular reflexes aren't proper, so you can get vertigo or blurred vision. Your gut might not move right, so you get constipation, or if it moves too much, diarrhea. You could have your salivary glands don't contract, they don't move, so you get dry mouth, and same thing with your lacrimal or tear ducts. Any type of abnormal movement, we see this quite commonly. Number 3, abnormal autonomics. Your autonomic part of your brain, your autonomic nervous system, controls bodily functions that we don't think about. It controls things like blood pressure and heart rate and circulation and digestion and making hormones and making enzymes, things that we're not consciously aware of. So we'll see a lot of digestive problems, a lot of hypertensive people, or even low blood pressure or hormone imbalances when the autonomic nervous system doesn't work well because those neurons aren't getting enough energy. Abnormal cognition, cognitive changes. When the neurons, especially in our frontal lobes, start to get weak because they don't have enough energy, we'll see things like depression and anxiety and mood swings and lack of focus. You read something and you got to reread it 3-4 times. You walk into a room, you don't know why you're in there. Memory loss, all of these, not enjoying things that you used to enjoy. These are some common cognitive changes that will occur. And you go to your neurologist, you go to your doctor, and what are they going to do? They're going to give you a prescription for some medication, where in our clinic we're going to look at why these things aren't working, okay? And then abnormal posture is the 5th category. Our brain is constantly making sure that our muscles that fight gravity, our anti-gravity muscles, our extensors, are always working so that we can negotiate against gravity all day long. And so when the brain gets weak, we start to lose postural tone, and we start to get chronic neck problems, back problems, hip, knee, musculoskeletal problems. This is the model that we use in our clinic. We use laboratory testing way beyond what traditional medicine will do to identify and then teach you exactly what your metabolic problems are and go about fixing them through natural means. And if medical intervention is necessary, then we refer you to the medical doctor. And then we use functional neurology to stimulate and activate the neurons that are weak, and we give better energy supply to the neurons. I'm Dr. Ed Beyer. Hope you have a great day.